helping make your life easier. Moms Every Day.
Hey everybody, welcome to Moms Every Day. I'm Hattie Cheek, back after having a few days off. And so today we have Dr. Day with us from Campbell Huntington Hospital. He's an orthopedic surgeon. And so we're talking about, you know, what you deal with when it comes to teenagers, young people. When it comes to the trauma, what are you seeing in teenagers in West Virginia?
Well, there's a couple of types of injury patterns we tend to see in the adolescent and teenage years. The low energy, the innocent type injuries, you know, rough play, bicycle riding, falling from trees, and that's a common thing to see. But we'll also see some more high energy stuff that usually involves some form of gasoline and a misadventure. And these tend to be a little more serious, and they can be quite dramatic at times.
What kinds of things are you seeing from those uses? You're saying from like cars and things of that nature? Cars,
ATVs, motorcycles, anything of that nature. And it goes from being on the road, walking down the street and being hit by a car, to driving and having an accident.
And so the teens seem to be, you know, a little more on the reckless side, I guess, when it comes to those things, or?
Well, children, you know, it's wonderful to be a child again, but they tend to, they tend to see the world in an unexperienced view. There's no experience. They don't recognize the risks that are associated with certain behaviors, and they will go out and do things that are borderline reckless at times, and you know, can have bad outcomes from these sort of things.
One day they're falling from the tree just because they're playing it, and the next they're driving a car and something happens. I guess that's how it changes in life. So when we talk about the times of years that this happens, I mean, is there a seasonal pattern that goes with the injuries that you see?
Oh, yes. In the winter months, trauma tends to drop down. People aren't driving as much. You'll see more of these low energy things. People slip on ice and fall, you know, and simple wrist fractures, forearm fractures. In the springtime, summer months, particularly in the fall, you'll get into these more high energy things. They get out and get on the motorcycles, get on their ATVs. Your teenagers that are driving age will be driving. And that can happen any year in the driving, but it does seem to peak as well in the summer months too. And those tend to be the more serious injuries that occur.
So just anything that brings the kids out, or brings anyone out for that matter.
Absolutely.
Winter is their safest time.
Well, you'll see a high number of a little spike in injuries in the hunting season in November, where people fall from tree stands, and also gunshot wounds as well.
Yeah, unfortunately, yeah. Do you see a lot of that, a lot of hunting things? Because that's just so big in this area.
You see a lot of people, and most of it's falling from tree stands and that sort of thing, getting up there when it's wet, or falling asleep in the tree stand, and out you come. And they can be pretty high, so that's a substantial fall when it does occur. Right,
so given that example, if something like that were to happen this coming hunting season, what would that trauma scenario pan out to be like?
Well, all the traumas, again, it depends on what's happened. You know, a fall, you know, somebody doing, you know, karate, or breaking their leg doing, you know, soccer or something like that. It's a whole different issue than somebody who has an injury in a car crash. That usually responds an EMS crew or something of that nature to the scene, and that ratchets up the acuity when they come to the hospital considerably. A person who is a trauma patient, a true trauma patient. Now, this is all trauma, obviously. When you break a wrist, the person will tell you it's very traumatic. Yeah. But when you've been in a car crash and you have broken your thigh bone, and you know, you've injured your abdomen, or you know, been knocked out, and you have a pattern of injuries, that's a whole different issue. Coming into that activates a level of involvement in the ER that is multidisciplinary. You'll have the general surgeons, you'll have nursing, you'll have radiology, and it's a very dramatic event when that happens.
All hands on deck kind of scenario.
Yeah, exactly.
So how do we prevent this, or what tips do you have for parents in order to keep these kinds of things from happening?
Well, the best thing is education. You know, there's laws, and you know, really knowledge is your best preventative medicine. Okay, for ATVs, probably the simplest thing, and West Virginia has the highest injury and death rate per capita in the country.
Wow, for ATVs.
Yes.
So that's just something you need to remember, the risks. You need to talk to your kids about it and maybe even be a little pushy on your end even when you don't want to.
Absolutely. Yeah. Wearing a helmet can prevent a vast majority of the fatal injuries that occur. The #1 killer in these things is head injuries and neck injuries. Okay? So just a simple use of a helmet and staying off the roads are perhaps the 2 biggest things you can do. These things are powerful vehicles. They can go, you know, as fast as an automobile, but you know, they're not built to stay on the asphalt. When they crash, it's bad.
Okay, so wear a helmet and stay off the road and just continue to hammer those rules into your kids. Doctor, thank you for being here.
My pleasure. Thank you.
Have a good day.